Hello everyone. Today we are going to have a discussion on inhaled or swallowed objects. The aspiration and ingestion of foreign objects are potential complications that can occur during dental procedure such as root canal therapy, implantation, extraction and even routine examination. The foreign objects include endodontic instruments, implant components, burr, post, teeth, orthodontic brackets, restoration, and even dental mirror and irrigation needle. Although swallowed objects usually pass through the gastrointestinal tract without causing harm, occasionally they require removal. But if the foreign objects has been inhaled, means they are in airway and lungs, then they must be removed urgently. Management. Object appears to have fallen down the oropharynx. In that case, stop the dental treatment. Check whether the object is present in the patient's mouth or clothes, and if so, remove it. If the object is not found, put the patient into an upright position. Although the majority of ingested foreign bodies will pass through the gastrointestinal tract without incident, refer the patient for further medical assessment and management. If the patient is conscious with signs of airway obstruction can be partial or it can be complete. In case of partial airway obstruction, the breathing will be labored and it will be noisy. There will be some movement of air which can be felt from the mouth of the patient. But in case of complete airway obstruction, there will be attempts to breathe and no breathing sound. The air will not emit from nose or mouth when you will check the nose or the mouth of the patient. In these cases, you have to call 000 and encourage patient to cough and do deep breathing. If the coughing is ineffective, you have to give 5 back blows between the shoulder blades using the heel of the hand. If the back blows are unsuccessful, give up to 5 chest thrusts, which are delivered at the same compression point as for the CPR, checking for effectiveness between each chest thrust. Continue to alternate between back blows and chest thrust until the obstruction is relieved or assistance has arrived. This is a flow chart to assess the severity. If there is mild airway obstruction, encourage patient to cough until the obstruction has been relieved. And if there is severe airway obstruction and the patient is conscious, give 5 back blows and 5 thrusts and alternate between back blows and thrust. If the patient is unconscious, call 000, inspect back of the neck for foreign object and remove if possible, and start CPR. The preventive measures to minimize the risk of inhaled or swallowed objects. If possible, use a rubber dam for procedures with a high risk of inhaling or swallowing a foreign body. If the procedure precludes the use of rubber dam, other precautions should be taken, which includes ensuring a careful and unrushed approach, having the patient reclined rather than supine, having instruments and facilities available that can be used to retrieve an object from the oropharynx, tying dental floss to any object that can be dropped if it's appropriate, placing gauze across the back of the tongue to trap small items, example crown, that may be dropped, rotating the patient head so that a dropped object will fall to the side of a mouth, using high volume suction. Thank you everyone.